I am Laurie Buchwald. I am a women's health nurse practitioner and also a family nurse practitioner. I am fortunate to be working with Virginia Women's Health. It's a OBGYN group that's associated with LewisGale Montgomery Hospital. We have the main office here in Blacksburg, and then we have 2 satellite offices, one in Radford, one in Parisburg. Besides myself as the nurse practitioner, I work with 4 physician colleagues. When I moved here 20 years ago, there was an OBGYN group called Radford OBGYN, and I was the first nurse practitioner with that group. A lot of people still weren't sure what a nurse practitioner was. That was one of the few groups in the New River Valley. People were coming from all over Southwest Virginia. They come from as far away as Bland County, Scott County. They come a long way away, so they're really grateful to have that Radford office because it saves them an extra 20, 25 minutes. I'm very honored that they will continue to come see me when it's an hour drive. And I have patients that have been coming the entire 20 years I've been practicing here. I think there are other choices now further down the road, but I think once you develop that relationship, I mean, they come in and we're all hugs and kisses and how have you been this year? It's an honor to me that people would follow my nurse and I. Dorcas and I have been working together for 19 years, and people come for her as much as they come for me. I think that really it's about the personality of the provider. For me personally, it's a priority. Every woman I meet, I know who her husband or wife is. I know the names of her children. I know what her job is. I know her mother's in a nursing home. I know her brother just died. There are many MDs that are the same way, and there are NPs that are not. So to me, you have to find the person that you can really connect with, that is going to give you that level of comfort. I want to try to treat the woman with respect, to hear what she's trying to tell me, to be able to look at the whole picture of her and what's making her situation and where she is in her life. A big part of it is prevention. I talk to women at all ages, so when they're teenagers, I'm talking to them about safety. Put your seatbelt on, wear your sunscreen, go with the buddy system, be aware of the date rape drug. I talk to everyone about heart disease. I talk to everyone about bone loss and how you can prevent bone loss, and exercise for mental health. It's trying to figure out what makes her tick and trying to help her be as healthy as she can be down the road. Because if somebody comes in reading a book, I'm like, oh my God, what book are you reading? And then we have a book discussion, which gets me behind, but that's okay. That's what makes it fun for me, too. Oh, I ride a bike, too. We talk about Harleys for a few minutes. Or a patient came in the other day to tell me about her trip to New Zealand. I'm going to New Zealand in February. Gotta have fun in your job. I like to tell my patients I'm a detective. I don't know everything by any stretch, and I don't have all the answers, but I am a detective, and I will figure it out, even if it's sending to somebody else who can, figure it out for me. As a nurse practitioner, I have a scope of practice that allows me to provide health care to women across the OBGYN spectrum. So I work in a team approach with my physician colleagues. I might see a woman who comes in who needs to have surgical intervention, and I'm able to provide her do her health care for her, and order whatever testing needs to be done and refer her to the appropriate surgeon as needed. But I have many patients that I've been seeing for 20 years in the New River Valley that have never needed to be seen by a physician because I'm able to provide their complete GYN care. I don't take call for delivery, and I certainly don't do surgery, but I'm able to provide a full range of OBGYN care. One of the things that's concerning, that's always challenging, is the woman who's been seen by a lot of different providers, and she's been had a condition for 5 years, and she comes in and I'm like, we're gonna fix this, and we do, and that's a thrill, because you're making such a huge difference in somebody's quality of life. I have been with the LewisGale organization since 2016, and one of the things that I have been pleased with is their focus on patient care, especially in terms of communicating with the patient and providing the best guest service. They want every point of contact to be a positive one for the patient. And that's something that's, I think, is terrific. I have been in private practice my entire career. This is the first time I've ever worked for a corporation. And I'm just going to tell you that I had some anxiety about that. And to see that the corporation's focus has been on excellent service for the patient, that's been so reassuring for me. I feel like I am given every opportunity to make sure the patient gets the care she needs. Whether it's ordering a test or setting up a referral, I need to know who in the community might be able to offer this service. I'm going to be given a name for that. Whenever there's a new provider to the community, they bring that provider around. The other day I got to meet a new psychiatrist, and I have already referred a patient to her because I was needing a new psychiatrist to refer to. I feel like LewisGale has made that opportunity easier for me to give my patients that full care. If I don't provide that type of care, if I don't provide a service, there's somebody in the organization that can do that.